Now I'm going to call on the Ontario Medical Association. Just a reminder, you have 7 minutes, and then once your presentation is up, we'll start the question rotation. Please don't forget to state your name too before you start your presentation.
Thank you, Chair. Good afternoon. My name is Allan. I'm the CEO of the Ontario Medical Association. Can you hear me okay? Yep. There we go. How's that? Good afternoon, everyone. Allan Odette from the Ontario Medical Association. I'd like to thank the members of the committee for providing the OMA with this opportunity to present our views on Bill 60 or Health Act 2023. And we'll follow this presentation up with a written and more detailed submission. I'm joined today, although you can't see her, sat beside me, Dr. Rose Zacharias, who is the president of the OMA. There she is. We welcome the government's proposed legislative framework for new community surgical and diagnostic centers. It's the right thing to do. It helps reduce wait times, which is critical both for the health of patients and for the health of the system that cares for them. We believe it'll free up hospital resources to focus on emergency, acute, and complex cases while relieving some capacity issues that are big and they're real. The Auditor General's recent report on outpatient surgeries in Ontario emphasized the experience in other jurisdictions, Canadian, that community surgical centers can treat 20 to 30% more patients within the same amount of time. And they can do these because these centers, their staff and equipment focus on a more narrow range of procedures. The OMA is encouraged by the proposed legislation because it aligns with our recommendations and some key principles for establishing integrated surgical and diagnostic centers. Those principles need to be protecting the stability of human health resources, doctors, nurses, and other healthcare workers at public hospitals and other healthcare settings, ensuring community health service centers operate within the publicly funded health system paid for by OHIP and does not allow and protect against queue jumping. Ensure that the quality of care and patient safety levels are at and above a standard of any hospital setting, and ensure that these centers are fully integrated with hospitals and other healthcare settings. We request, again, directly that we be fully engaged along with some other stakeholders in implementation. I'd like to just quickly take the opportunity to raise just a couple of concerns around two proposed amendments. The first is how we define a physician, and the second is with regard to pharmacy scope of practice. We understand the intent of these amendments, and we raise concern in the spirit of avoiding any unintended consequence. The bill proposes to expand pharmacy scope of practice to include assessment of conditions for the purpose of providing medication therapies. So we continue to have concerns with the government's decision to authorize pharmacists to prescribe for common ailments. Again, our only North Star is patient safety, and that's our utmost concern. I'm going to pass it to Dr. Zacharias. I know she's keen to share her thoughts with the committee. And I appreciate the time.
Thank you so much. My name is Dr. Rose Zacharias. I'm the president at the Ontario Medical Association. I'm also a family doctor who's worked in the emergency department for 20 years. Every day I see firsthand the challenges in our healthcare system and the impact that they have on our patients. Thank you for the opportunity to speak on Bill 60 and to try to bring in the views of Ontario's 43,000 physicians. We're eager to collaborate with the government on Bill 60's implementation, specifically proposing assembling an expert panel of physician leaders to provide clinical advice to the ministry. Doctors have been strongly advocating for solutions to eliminate surgical backlogs and reduce wait times, which were a major concern even before the pandemic. No patient should be waiting months or years for a surgery that they need. In 2022, we called on the government to create integrated ambulatory centers for outpatient surgeries and procedures. We support Bill 60's key feature to move lower acuity surgeries and procedures out of hospitals. This is an important step in reducing wait times. As Allan mentioned, community surgery centers can treat patients in numbers that could never be achieved in a hospital setting. Patients also recover faster and experience lower infection rates. We have seen this. That's good news for patients. It's also good news for our healthcare system because it means hospital resources can be freed up to focus on emergency, acute, and complex cases, which relieves strain on capacity. We look forward to working with the government on implementation to ensure community surgical centers adhere to 4 critical principles that Ontario's doctors believe must be followed with respect to a human health resource strategy, also public funding through OHIP, also quality of service and patient safety, of course, and integration with other healthcare settings. With regards to the definition of physician and pharmacist scope of practice, we support the intent of the change in definition of physician. However, as Allan noted, we're concerned that permitting regulation-making authority to include others within the definition of physician creates a risk for future misinterpretation, which could lead to including non-physicians. And so we recommend that physician be defined as a member of the College of Physicians and Surgeons of Ontario, or another person who is lawfully entitled to practice medicine in Canada as a member of a provincial or territorial medical regulatory authority subject to conditions prescribed by the regulations. We believe that this amendment is consistent with the intent of the proposed legislation. It's necessary to offer clarity and ensure public trust in the physician title. Lastly, with regards to pharmacist scope of practice, we urge the government to reconsider the bill's wording to ensure that it reflects the stated intent of the amendment and avoid the term assessment, which is uniquely a medical term with respect to the physician scope of practice underneath the Medicine Act of 1991. The OMA's written submission provides more details, and once again, we are very grateful to have a say on this important piece of legislation and provide the best patient care possible to all Ontarians. Thank you so much.
Thank you.